Swayam Prabha. Digital India. Educated India.
Hello everyone, welcome to the course on computer aided drug design. We will continue on the topic of drug likeness. So, we saw many factors that contribute towards the drug likeness property. The first one was PGB efflux. These are proteins, P glycoprotein proteins in the cell membrane that pumps many foreign substances out of the cells. So, they act like an efflux pump. So, the drug also gets effluxed. Then we have to consider the metabolism and biotransformation that are taking place inside in the liver, enzymes like oxidoreductases, hydroxylation. So, it affects the drug may become more active or less active, the metabolites could be toxic. So, we need to understand that. Plasma stability, we have a lot of hydrolytic enzymes in the plasma region. Again they may be modifying the structure of the drug and making it inactive. Plasma binding, there are a lot of proteins in the plasma like human serum albumin, alpha acid glycoprotein, lipoprotein. So, organic anions like carboxylic acids, phenols bind strongly to human serum albumin, whereas amines and hydrophobic compounds bind to AGP, steroids they bind to AGP. So, the bioavailability of the drug may go down. Then there was another concept called HERG blocking. These are proteins which are involved in potassium signaling, and again which is in turn combined with the electric activity of the heart and hence the heartbeat. So, any disturbance drugs blocking this particular protein will affect the heartbeat, heart rhythm, okay, and hence you need to know whether the drugs have any effect on the cardiovascular activity. Then toxicity is related to whether the drug has short term, long term toxicity, genotoxicity, cytotoxicity, and so on. So, we need to understand those aspects as well. So, all these contributes to the drug likeness property. Like I mentioned, there is a software which tries to predict toxicity properties. It provides fragments to aid interpreting prediction. This is the particular link for that. I will just show you that. So, we have it is called a COFFER. So, it can predict a lot of toxicities, as you can see AMS test mutagenicity, carcinogenicity, then estrogen, tyrosine protein kinase inhibition, cytochrome P450. So, a lot of these. For example, let me see MS test mutagenicity. Okay. So, you want to know whether your compound which you are trying to is mutagenic. I went to zinc database, I picked up say metformin, and then I copy the SMILES notation, and then I can put that here. Okay. Then I can say predict. So, it gives you mutagen, non-mutagen. Okay. So, it tells that some of these fragments are there and present in the test compound. Okay. They may be activating. Okay, they may be contributing towards mutagenicity, as you can see some of these groups here. When you have the red color here, it means that actually, and it also gives little bit information about the compound here information. So, you can spend more time, we can look at a lot of different carcinogenicity in mouse model. Okay, again we can put in the, okay, it gives you a prediction. So, you can see that a lot of these fragments are also part of the carcinogenic activity. It has an activating effect. Okay, it has an activating effect. So a lot of information is available, so they may be contributing to the carcinogenicity in some mouse model. So we can look at a large number of okay, predictions using this fingerprint based method. Okay, we can even look at say cytochrome P450, as I had showed before. Cytochrome P450 is involved in okay, many of these activities, so we can predict whether these compounds are part of the cytochrome P450 activating. So this software can give you a lot of information that predicts chemical components, fragments, and adding to prediction. Okay. So it not only looks at the whole compound, it looks at the fragments that are that could form from that particular compound, and then tries to predict the properties of those fragments. Okay. So this is a useful tool, and there are many toxicity predicting tools available online free of charge. So you can check out your compound also. Okay. So drug likeness, lead like compounds. There are many rules, just like we looked at Lipinski's rule and Muget rule and things like that. This is called Oprea rule of 3. 2001 molecular weight should be less than 300. As you can see, Lipinski's rule we said less than 500. Log P less than 3. So again log P also has become very stringent. Number of hydrogen bond donors less than 3, number of hydrogen bond acceptors 3. So they seem to have all 3 coming. Flexible bonds 3, they bring in another parameter called flexible bond. Polar surface area less than 60 angstrom. Okay. So according to them the molecule should have this type of behavior. Why this polar surface area? If you remember the graph I showed you once, as the polar surface area increases, the permeability through the GI goes down. So one would like to operate in this region, right? That is why polar surface area is left low. But this rule is more stringent than, as you can see, Lipinski's rule. There is another rule that is called Han et al. Rule. Bioavailability greater than 30, clearance less than 30 ml per minute per kg in rat. Log D at 7.4 should be this, binding to cytochrome should be low, plasma protein binding should be less than 99.5, acute and chronic toxicity none, genotoxicity, carcinogenicity, tetragenicity none at dose 5 to 10 times the therapeutic window. So this is very important. Generally we always operate 1/10 of the toxic limits generally. Okay, so that is the Han et al. Rule for drug likeness property. Here you have the Opera rule of 3 for drug likeness. There is another rule called Egan et al. They say bad or good oral bioavailability rule. Okay, so they say total polar surface area should be less than 132. Okay, so 132 may be falling here. Okay, a little bit more, whereas Oprea rule is very stringent, less than 60. Log P between -1 to less than 6. So you see this is another rule which tells you what should be a good descriptor or parameters for a molecule to have good oral bioavailability and drug likeness property. Okay. So there is another freeware, it is called ADME tox filtering tool FAF drugs 4. This is a program for filtering large compound libraries prior to in silico screening. So we can screen large number of compounds. This is the link for that. I will just show you that. I will show you that link also for you to look at. Okay, this is the FAF drugs 4. So it gives you a lot of calculations possibilities. We can look at ADME tox. We can use as physical chem descriptors, as you can see, molecular weight, log P, log D, log solubility, polar surface area, hydrogen bond donors, hydrogen bond acceptors, total hydrogen bond, number of rings, small set of smaller rings, biggest system ring, number of rotatable bonds, carbon atoms, heteroatoms. Hetero means hydrogen not included. Number of heavy atoms, hetero to carbon atom ratio, Egan's rule, oral physical chemistry. So we can do a lot of descriptor calculations, okay. We can even do filtering based on the descriptors, okay. So let us look at a system, run FAF. So when you say run, it gives you like this. So imagine I am uploading a structure, I can upload choose a file, I can go to computer, it needs a SDF file, so I am loading a SDF file. This is Bextra, this is selective cyclooxygenase 2 inhibitor, okay. So I have loaded this file, and then I can do a lot of calculations here. As you can go down, we can say log p computation, then we can look at filtering possibilities here. Okay, no, so we can say just run. So it calculates, so it does a lot of calculations, and then it gives you a lot of properties. So if you have many molecules put in, okay, so it does a lot of these calculations, molecular weight, log p, log d, solubilities, rotatable bonds, rigid bonds, flexibility, donors, acceptors, okay. So a lot of information it gives about the compound. As you can see, hydrogen bond, heteroatoms, total charge, heavy atoms, carbon atom. Then it gives you oral bioavailability is good, Egan rule is also good, okay. So if I have lot of 30 molecules or more, I can even prepare histograms showing a particular property, the histogram of a particular property. I can put a histogram of log p, or I can put a histogram based on log s, and so on actually, okay. So this is a very good software for one to study the drug likeness property, try to collect information on various descriptors, and it is a freeware, okay. So we looked at quite a lot about the drug likeness, the oral bioavailability, and what are the issues related when the drug travels from the oral cavity right up to the target site, how the pH changes, how the solubility changes, how it may get biotransformed because of presence of enzyme, or it may be getting absorbed in plasma region, and what are the side effects it would cause, especially to cardiac or create toxicity, and so on. Okay, let us look at another important subject, that is called bioisosters. Okay, this what is this bioisosters? This is the phenomena observed between substances structurally related, okay. So when they are structurally related, they will have similar or antagonistic biological properties. This is what is called bioisosters. So if they are structurally related, chances are they will exhibit similar biological property. So these isosters are elements, molecules or ions which have the same number of electrons at the valence level, okay. So if they have same number of electrons at the valence level, the chances are they may exhibit similar property. That is what is the concept of bioisosters, and it is very useful when you are doing drug design, okay. A chemical group can be mimicked by a similar group, that is what is bioisostor. So, so this and this are bioisosters, because you have here double bond here dia. So chances are they may have similar biological properties. So if you have a molecule with this as a group, if I replace it with this group, chances are it will have similar biological activity, okay. So for example, look at this, these are all antibacterial sulfur based drugs. Okay. So this portion is the same, so there are just a difference here. Okay. Piperidine and then some heterocycle, nitrogen oxygen heterocycle. Okay. So these groups can be replaced against each other and you get similar activity. Look at this, I had shown this long time back. These are selective cyclooxygenase 2 drugs. These are manufactured by Pfizer and Merck and so on. Celecoxib, etirecoxib, validecoxib. Look at this. They have, see, the diaryl, all of them, and then there is a heterocycle group here. Okay, 5 member or even 6 member heterocycle, 6 member. Okay, so these compounds have similar activity, not exact activity, similar activity. So these can be called bioisosters. Analgesic, nicotine, ABT41857. This is a clinical trial drug. Look at this. Okay, these are all, these two are bioisosters. Anti-ulcer, this portion is the same, ramotodome and nizatidine. Look at this, the heterocycles are different. This is an oxygen 5 member, this is a dinitro 5 member drinks. This is a male erectile dysfunction drug. Okay, sildenafil, vardenafil. Okay, look at this. This portion is the same, so this portion has been replaced and they exhibit similar activity. So sulfenamide, for example, an active metabolite of prontosol, an antibacterial similar in structure to para-aminobenzoic acid. Look, so this is a substrate of bacteria, this is the sulfur drug which was designed to mimic the substrate, so it goes and binds to the same active site and kills the bacteria. Okay. These are sulfur drugs which were discovered long time back after the First World War. They are competitive inhibitors. So there is a Grimm's hydride displacement law. According to that law, these are bioisosters, these are bioisosters, these are bioisosters. So what does it mean? If I have a molecule with a OH group, I can replace it with NH2, then I expect it to have similar activity, or I can replace it with CH3 and expect it to have similar activity. Of course, the other properties may change, will change of course, because hydrophilic to hydrophobic, so solubility may change, total polar surface area may change, hydrogen bond acceptor donation change, but we are talking about bioactivity. Bioisosters talk only about bioactivity. So I could come up with new structures because maybe some properties are not good. So I want to make it more hydrophobic, for example, so I may replace a NH2 with CH3, expect it to have similar activity, but as you know, it is no more a hydrogen bond acceptor, it is more hydrophobic as well. So some of the other drug likeness property may change. So same here, NH can be replaced by CH2. Okay. So these are bioisosters based on these, and hence we can design new molecules and expect to maintain the activity same, but change the other properties like solubility, maybe log P, maybe hydrogen bond accepting capability or hydrogen bond donating capability. So all these could be changed if I know what are the bioisosters of certain functional groups, where I showed you a lot of examples of. Okay. Classic bioisosters, these are called classic bioisosters. So like monovalent atoms or group, divalent atoms or group, trivalent atoms or group, tetra-substituted atoms, ring equivalents, all these are classic bioisosters as you can see here. Okay. Look at this. Of course, you also have non-classic bioisosters, cyclic versus non-cyclic, functional groups, retroisosterism. So we have groups which fall into this category. Okay. So these are called bioisosters. So the more great advantage of it is if I know which groups could be replaced by its own bioisoster, I expect the compound to have this similar activity, but it will alter my other properties, the drug likeness property, physicochemical properties, based on the type of functional groups I am replacing it with. So, bioisosterism is very nice trick to play on molecules to change these properties, but maintain your activity similar. Now, another important concept which has become very important in the past 5 to 10 years, I would say, this is called pan-assay interference compounds, PAINS. What does this pan-assay interference compound means? When we do high throughput screening, we get sometimes irrelevant positives, false positives, frequent hitters, irrelevant compounds that interfere with the assay technology. Okay. So, it is not actually doing a biochemical inhibition of an enzyme. Suppose we are doing an enzyme assay with some compound, it is not actually working on the enzyme, but it may be interfering with the assay. For example, it may be absorbing or fluorescing at the assay wavelengths, or compounds that interfere with the assay components in a pharmacological irrelevant manner, okay, or it may be aggregating the protein, denaturing the protein. So, but it may appear as a hit when I do the screening. False positives, compound with a high probability of acting in a non-specific manner, okay. It is not acting very specifically either as a competitive inhibitor or allosteric, non-competitive. Frequent hitters, okay, it seems to be appearing in many irrelevant screens, okay, they are called PAINS, false positive. Techniques for identifying false negative can also be implemented and the compounds identified be reassessed, okay, especially when we are doing these type of things. Okay, let us go more deeper into that. This pan-assay interference compounds, their ability to show activity across a range of assay platforms and against a range of proteins. So, you may be doing a study on proteins in the inflammation, or you may be doing study on something else, maybe cardiovascular. The same compound may be appearing in many places, not because they are inhibiting this protein, but maybe they are affecting the assay itself, either fluorescing or absorbing in the same wavelength. Repeated identification of the same type of molecule as promising hit. So, it may appear as a promising hit against different protein. So, obviously in such situations you have to be careful. Most paint function as reactive chemicals rather than discriminating drugs. So, they may be reacting, they may be denaturing the protein or aggregating the protein rather than actually performing as a drug. For example, this is a very dangerous candidate, rhodamine. There are 2132 rhodamines reported as having biological activity in huge number of publications, rhodamines. So, it may be thought as if they are very good for therapeutic development, but actually they undergo light induced reactions that irreversibly modify the protein. Okay. So, the protein gets denatured, they get modified, whereas when we do the assay in the presence of rhodamines, you may think they are acting on the protein. So, they appear to be promising for therapeutic development and they seem to have a lot of biological situations. So, rhodamine, there are almost 2000 of them. So, they are not really compounds that may be taken up as a drug, but these are compounds which affect your assay, which affect your protein in an irreversible manner. Okay. They are called the pan-assay interference compounds. There are many compounds of that nature, okay, many nitrogen containing with the double bonds and so on. Look at this, okay, lot of these 5-member nitrogen double bonds, huge number of compounds. There are softwares, freewares where you upload your compound and it tells you whether your compound may be a interfering compound, okay, pan-assay interfering compound. Okay, these, if your compound has these type of functionalities, you better watch out, it may be a interfering compound. Okay. So, this software, this is what I said, if you go to this software you can upload your structures and be sure possibly whether it is a paints compound or not. So, how do we detect paints? We have to look at literature substructure search. We need to do some binding studies. If you are doing a protein based biochemical assay, if you think one compound is showing good activity, it is good to do a binding kinetics. Okay, that means you change the concentration of the substrate, concentration of the inhibitor, and see whether it follows the Michaelis-Menten. So, that is the binding kinetics. So, from there you will exactly find out whether your compound comes under this category of paints. Activity in biochemical and cell based assay. So, you do the biochemical and then go to cell based assays also. Screening using orthogonal assay. So, okay, you have found a hit in one particular assay, now try an assay which is totally different, orthogonally different, and then see whether your compound shows. Convincing SAR. So, if you have a compound which shows activity, then if I do structural modifications, electron withdrawing, electron donating, or hydrophobic, hydrophilic, do I get a good structure activity relationship? If not, then you better be careful that it could be a paints compound. Okay. So, you need to be very sure that your compound does not fall under this category and it is a genuine inhibitor for a particular protein of which you are studying. Okay. So, this concept of paints has become very important in the past 10 years, so that you do not end up with some false positives in your screening protocols. Okay. So, we will continue more in the next class. Thank you very much for your time.